Well, welcome to everyone in the room and who's on virtually. For those of you who participated in Heart of Hunter Part 1 in October, you know that you are in for a great afternoon of information and three fascinating women who are going to share all kinds of important health information in a really spirited and tremendous format. But and those of you who did not, you're going to be entertained and gain all sorts of great insights anyway. So it is my pleasure to introduce these remarkable women who we are privileged to have with us once again. We have two distinguished alumni. The first, in no particular order, because I can't see where they're positioned in the room and who will speak first, but the first is Dr. Annabelle Santos Volgman, who is class of 76. She is the co-founder and medical director of the Rush Heart Center for Women in Chicago. It's the first heart program in Chicago devoted exclusively to women, and that opened in 2003. A fellow of the American College of Cardiology and the American Heart Association, Dr. Volgman has dedicated her career to helping women and their families lead healthier lives through the prevention and treatment of cardiovascular disease. She remains heavily involved in many local and national causes, serving on the National Scientific Advisory Board of Women Heart, several national leadership committees of the American Heart Association, the American College of Cardiology, and Chicago not-for-profit institutions. She was elected governor of the Illinois American College of Cardiology and started her term in April of 2021. Dr. Nanette Wenger, from the class of 49, is professor of medicine in the Division of Cardiology at the Emory University School of Medicine. She is a consultant to the Emory Heart and Vascular Center and founding consultant of Emory's Women's Heart Center. Dr. Wenger has participated as author of several American College of Cardiology, American Heart Association clinical practice guidelines. She is past chair, board of directors, and Society of Women's Health Research. Dr. Wenger serves on editorial boards of numerous professional journals and is a sought-after lecturer for issues related to heart disease in women, heart disease in the elderly, cardiac rehabilitation, coronary prevention, and contemporary cardiac care. She is listed in Best Doctors in America. We could spend probably the entire time that we have allotted to us going over the credentials of both of these women. Dr. Wenger has authored or co-authored over 1,700 scientific and review articles and book chapters. Dr. Stacey Rosen, who didn't go to Hunter but could have, is executive director for Northwell's Katz Institute for Women's Health. Dr. Rosen is a leading expert in women's cardiovascular disease and oversees women's health services at Northwell, with a focus on the elimination of healthcare disparities through comprehensive clinical programs, gender-based research, community partnerships, and education. She has been a practicing cardiologist for over 30 years. She co-authored the book Heart Smarter for Women, 6 Weeks to a Healthier Heart, published in 2022, and co-produced the documentary Ms. Diagnosed, which premiered at the CineQuest Film Festival in 2020. A longtime volunteer for the American Heart Association, the AHA, Dr. Rosen will serve as the AHA president-elect beginning July 1st of 2024. Please welcome Dr. Rosen, Dr. Wenger, and Dr. Volgman.
Thank you so much, Vivian. That was a wonderful introduction. And Dr. Rosen certainly could have come to Hunter College High School, and we probably would have been here together. You would have been in Elena Kagan's class.
That's my class. That's my class.
That's right, Vivian. I give a talk about how to achieve academic success without an NIH grant, because I don't have the usual format of how to become a professor and an endowed chair at Rush University Medical Center. I did it by patient care and clinical work, and I also wrote papers, got some grants, but it was not for that reason that I became a professor. It was really taking care of patients and becoming very passionate about what I was doing. So education is the most important background that sets you up for academic success. And for me, Hunter College High School did that. Because it led me to get into Barnard College, which is another all-girls college. And I think that was instrumental in how I did what I did. I concentrated on taking care of women, and I never let anything, no barriers came because I was a woman, because at Hunter, everyone was the leader. It was all women that were presidents of the club, of committee members, of all the committees. There was no question that gender or sex was an issue to become a leader. So I think Hunter College High School was really instrumental, and that was even even more true at Barnard, because we did our own leadership as well at Barnard, which was separate from Columbia. And Barnard remains one of the only female-only colleges in the United States. So, which also led me to become a student of Columbia University, one of the best medical schools in the world. So I think that education is the foundation of anyone's success and career. And then I have, career, people have different careers. What makes a difference is whether you are passionate about what you're doing. And I became passionate about making sure that women got the best care. I had a patient who, I'm an electrophysiologist, which means that I take care of patients with arrhythmias. And I had a patient who had palpitations for almost a year. And she said, no one even got an EKG. And I got an EKG, an electrocardiogram, which can show me some secrets of her heart. And when I got the electrocardiogram, it showed that she has an accessory pathway that she was born with, and it was very evident on an EKG. And she never got it because she was always told, oh, you're just stressed out, you're just anxious. She came from a very affluent neighborhood in Chicago. And she said, you're from Lake Forest, you just have a lot of stress. Don't worry, a lot of women have these palpitations. But when she was referred to me, of course, the first thing I got was an EKG, and it showed me right away that she had a potentially curable problem. And sure enough, I ablated her accessory pathway, which she was born with, and she never had arrhythmias anymore. And we have become friends ever since. So I still keep in touch with her, and she has never had any more palpitations. But that was one of the reasons why I decided that this was an injustice to women, that she was labeled as being anxious and was not treated properly. And I became passionate about making sure that women got the right treatment. One of the other important things that you need to do is have publications, because if you don't write what you learn about, if you don't write what you know, it doesn't matter how much you know. If you don't publish it, people won't know. That's why Dr. Wenger, with her 1,700 publications, she has taught many of us about so many things, and she is the founder of Women and Cardiovascular Disease Treatment. So we thank her. She is our mentor. People follow her at these conferences, and everyone has to say hello to Dr. Wenger, because we are so grateful for what she has taught us. She taught us that do not approach heart disease, do not approach women's health with a bikini approach. It's not just about the breast and the reproductive system. It's about everything is different between men and women when it comes to their health, and we need to do that. But one other important thing that we need to remember is that you have to have colleagues and peers that will do this with you. And so I think that's what Dr. Wenger did for us, is she got us all together. She started writing about it, and we agreed with her, and we started following her. And she has mentored so many of us, including me. And so I was thrilled when I found out in her CV, when I was introducing her at one of these conferences, I saw it in her CV that she went to Hunter College High School. And I said, oh my God, this is such a coincidence. And we've become friends ever since. And we've done so many things together. And so yes, around the world. We've been in France, we've been so many places together. So I'm so lucky to be one of her friends. This is the reason also that I got involved with the American Heart Association. And Dr. Rosen, who's going to be the president-elect, knows just how passionate we all are about this. When it was found that men had a little more mortality. So in 1979, the blue line shows the mortality for men. So there were about 30,000 men dying of heart disease than women. And so it became known as a man's disease. Unfortunately, it was labeled, heart disease was labeled as a man's disease. And that was what led to women being undertreated for heart disease. And women were not taking care of themselves. They didn't think that heart disease was their problem. And so you can see the mortality in the red line started going up, so that the men did better. They decreased their cardiovascular disease mortality, which is the #1 cause of mortality in the United States, and it still is, unfortunately. And women started to die from cardiovascular disease, partly, possibly from giving them hormone replacement therapy to treat their cholesterol and to see if it would prevent cardiovascular disease. So this led to worse outcomes in women. There were 70,000 women dying of heart disease, 70,000 more women dying of heart disease than men by the year 2000. It also happened that the WHI study came out in that year, which is the Women's Health Initiative. And you would not believe this, but the Women's Health Initiative was started by Bernadine Healy, another Hunter College High School alum. And that's what led me to this path of showing off my colleagues who went to Hunter College High School, because Hunter College High School is really, yes, and Elena Kagan is also an alum of, and she hopefully will help us in our fight for women. But Dr. Bernadine Healy was the one who was the first director of the NIH and started the multi-billion-dollar work that the NIH did to study all diseases in women. And hormone replacement study was one of the most important ones that showed us that giving hormone replacement therapy to older women, the average age was about 62, that were given hormone replacement therapy. And it's too late to give them hormone replacement therapy if they didn't need it. And that led to increased strokes and heart attacks and breast cancer, that formulation of hormone replacement therapy. So we did a lot of work to raise awareness about heart disease in women. We started heart centers for women. We treated women with statins. And you can see that now the cardiovascular mortality in women plummeted since then. It's still going up, unfortunately. COVID did us a big disservice. Mortality from cardiovascular disease started to really go up with COVID. Treatment was not as fast when people started having heart attacks and strokes, and so they started dying. So it's a battle, and Dr. Rosen is going to help us change that. So I would not be here without my mentors and sponsors. And a sponsor is somebody who increases your visibility, who gives you opportunities. And Dr. Kim Williams is one of my mentors. And it turns out that Dr. Kim Williams' mentor is Dr. Nanette Wenger. Dr. Nanette Wenger was his attending when he was at Emory as a resident. So it all just goes back to Dr. Wenger. He taught me, he mentored me, and he raised me to the level that I became the governor of the Illinois ACC, which gave me a lot of leadership opportunities. And of course, Dr. Wenger is my mentor, my sponsor, my friend, and paying it forward to Dr. Wenger's right is Dr. Gina Lundberg, who is the redhead sitting next to her. But she is my mentee and also Dr. Wenger's mentee. So it comes full circle that we all teach each other. And this was a conference that we had during the American Heart Association in Chicago, where we looked at sex differences in cardiovascular disease. And that was a fun conference because we learned about the differences between men and women, and we had to learn about the effects of prostate cancer on heart disease, and that was really interesting. Dr. Wenger, as you all know, I don't have to tell you, is one of the founding members of Women Heart, I believe. She's on the scientific advisory committee, and both Dr. Rosen and I have been honored to be given awards by this organization. Women Heart is a national coalition of women with heart disease, and they learn how to talk to patients, to support them, to educate them, and to advocate. So both Dr. Rosen and I have received awards from the Wenger Awards from Women Heart. So that was a lot of fun. I think I nominated you 2 years ago, or maybe a year ago, and we celebrated in Washington, D.C., along with several other wonderful women who've done so much for women with heart disease. Okay. So 20 years ago, after I treated that patient, I was really incensed about how she was treated. And the American Heart Association, in about 1999, started approaching us about increasing awareness about heart disease in women. And we would go to churches and talk about heart disease in women, especially in the African American communities, because they had worse outcomes than other races. So we would specifically go to those neighborhoods. And we decided to build the Heart Center for Women in 2003. And back then, there were only 2 cardiologists that started that. And fast forward 20 years later, we just celebrated the 20th year anniversary of the Rush Heart Center for Women. And we now have 12 female cardiologists, and half of our fellows are women. So I'm very proud that we have made some advances. We had speakers at our Go Red for Women luncheon. Michelle Obama, before she was the first lady, was the senator's wife, and we were still able to get her to talk at one of our Go Red for Women luncheon. Larry King was also a supporter of our efforts. As you know, he got operated on for his bypass surgery at Columbia, and he worried about the people who needed bypass surgery. If they didn't have insurance, they would not have gotten it. So he started a Larry King Foundation that would help pay for bypass surgeries in patients with no insurance. And that was before the Affordable Care Act, or the Obamacare. So we don't have the Larry King Foundation anymore because Obama changed that. My other peers are also instrumental in getting publications. And I like to show this because I wanted to show young people that they're very anxious about their careers in academic medicine or academic cardiology, that they're not writing papers, that they're not publishing. And I showed them that it's never too late to publish, because for about 20 years, I I did not publish. As you can see, there's like one or two, maybe, over 20 years. I'm not Dr. Wenger, who has 1,700 publications. So my son was born in 1992, and then my daughter was born in 1996. And then I started getting involved with the American Heart Association. So I became very busy with my children and doing the Go Red for Women. I started wearing red every day. So my whole closet is red, just to increase awareness about heart disease in women. And so I was learning a lot. So this is my family, my young family. They're now a little bit older. But, you know, I really learned a lot from being a mother. And also, I had so many friends from the relationships that my kids had with moms. And I joined a women's athletic club where we had the Hunter College High School alum celebration. And because I was friends with so many women, it became the Heart Center for Women became very successful and helped me grow that program. They gave donations to Rush, they gave donations to the American Heart Association, and we were very lucky. In 2014, I became an empty nester, and that's when I started publishing. I had time in my hands. My daughter went to Vanderbilt, and all of a sudden I had nothing to do on the weekend, or in the evening. So I started writing papers, and as you can see, I have a few more publications. So now I have 170 publications to Dr. Wenger's 1,700 publications. And I became more involved with the organizations. I started not just volunteering for the American Heart Association, but for also the American College of Cardiology. And I found so many kindred spirits at the American College of Cardiology. We were all just wanting to do the best we can do for our patients. And it's just become a wonderful group of friends that I have. And Dr. Rosen is one of my auto-raft friends. We have a WhatsApp and we share our lives together. And that has been an incredibly fulfilling part of our lives, not just to share about our families, but to share, you know, the negative things about heart disease and being a cardiologist. It's all a part of our lives. My colleagues at Rush, these are some of my fellows. I treat them very well. I try, because they work really hard and they don't make any money at all. After 4 years of college, 4 years of medical school, they earn $70,000 a year and maybe $90,000 by the time they finish, and they have no money. And so I treat them to dinners, I treat them to retreats, I treat them to the ballet. This is one of the Joffrey Ballet. I'm on the women's board of the Joffrey Ballet, and so I take them to lunches. This is one of the Go Red for Women lunch where everyone has to wear red, including Dr. Kim Williams, who's wearing red over there. So he became my chief of cardiology. So the Rush Heart Center for Women started out, as I said, in 2003, and we just celebrated the 20th year anniversary. And because I also volunteered for the American Heart Association for all those years, I was always raising money for the American Heart Association. And in their 20th year anniversary of the Go Red for Women, they honored the Rush Heart Center for Women and me with an award. So I'm incredibly proud of all the work that we've done. I think we've done a lot of good. We continue to do a lot of good for women in heart disease and for all patients with heart disease. Learning about sex differences in heart disease also improves learning about men and heart disease. So these are some of the pictures that we had at that wonderful Go Red for Women luncheon that we just had in Chicago. Together, we've published over 100 papers. I'm not going to talk about all of them to you, but I just wanted to show some of the papers that we've written. We talked about, in this paper, we talked about how to build a heart center for women, why we did it, and what we hope to continue doing. And there are other papers that we've written in many different topics of different heart diseases. This one was to treat how women should be treated when they have risk factors. And there are differences in heart disease in women and men. And so this was just to emphasize that there are emerging risk factors that we're finding about, including gestational diabetes, gestational hypertension, and preeclampsia can increase your risk of cardiovascular disease. We also wrote a theory paper that microvascular disease and small vessel disease may be the reason why women have different diseases than men. And we know that many diseases that affect women have a microvascular disease or small vessel disease as part of their increased mortality from different diseases such as lupus, such as dementia, pulmonary hypertension. So we wrote about that in this paper. And we also wrote about the link between heart disease and breast cancer. This was one of the committees that I joined at the American Heart Association. So we wrote the scientific paper to increase awareness about the differences, the similarities in heart disease and breast cancer risk factors, and how to treat women with breast cancer when they develop heart disease, or if they have heart disease and they develop breast cancer. We also talked about or wrote about how different adjuvant therapies, when somebody gets breast cancer, they are given chemotherapy to prevent breast cancer, and how that affects the heart. And there are differences, and it does increase the risk of heart disease when they're given aromatase inhibitors such as Arimidex. As I mentioned before, I'm an electrophysiologist, and so I've written many papers on women and arrhythmias. Dr. Wenger was one of my colleagues who wrote this paper. We wanted to emphasize the sex differences in atrial fibrillation, and I'm so happy to see that there are now many papers being written to look at sex differences in arrhythmias, especially atrial fibrillation, because women were not being treated as appropriately as men when it came to anticoagulation or aggressive treatment of their arrhythmias, such as catheter ablations. And we really learned about also pregnancy and heart disease, and how we can decrease maternal mortality. As you may all know, it's been in the news that maternal mortality is the highest in the United States compared to all industrialized countries. And we really are trying to figure out how we can decrease that maternal mortality. So we wrote many papers on pregnancy and heart disease and different topics. So as you can see, we've done a lot of papers, not as many as Dr. Wenger, but she's been one of the co-authors of many of these papers that we've written. This one was on cognitive function. Dr. Wenger was passionate about this as well. She is also interested in geriatric cardiology, so she and I have this common interest in what the link is between heart disease and cognitive function. So we wrote this paper to increase awareness about that connection. And we actually have a cardiocognitive neurologist that works at the Heart Center for Women. We learned how to treat, how to decrease risk in African-American women. One of my colleagues at Rush has a PhD in nursing, and she is avid research that gets a lot of NIH fundings, and this is one of my NIH funding that we studied, women with heart disease and how to decrease cognitive function. So we got a $4 million grant from the NIH to study whether physical activity or brain games, or just leaving them alone, or both, doing both physical activity or brain games, can decrease cognitive decline. So we're about to publish those studies. So as you can see, I've written a lot of articles, but I just wanted to show that Hunter was really the beginning of my passion for women, because without the education that I got, I would not have gotten to where I got. One thing that Hunter did not teach me and Dr. Wenger was typing. I remember they would tell us, we're not going to teach you typing because we don't want you to become secretaries. Unfortunately, that was a big disservice. I hope they're teaching them now, because we need to learn how to type from very early on so that we can work with our computers. But you know, everything else was fabulous at Hunter. These are just some of the pictures from the celebration that we had at Rush when we had our 20th year anniversary. And I actually have become the past director of the Rush Heart Center for Women, because I believe in paying it forward. Dr. Sangani, who is my very able colleague, is now the director. But paying it forward, these are some of my mentees. I have many more that I just didn't put down, but my children are my two mentees, and just wonderful to see them grow up and do what they want to do. But these are some of my mentees that have gone to many amazing places all over the country: Stanford, Harvard, Emory, many wonderful places to also do what we do for our patients with heart disease. And then I am so fortunate that I get to also mentor my new grandson, who is pictured over there. My daughter just had a baby 8 months ago. And this was a picture that we took when it was the Go Red for Women Day. We dressed him in red, and he looked totally adorable. So I have my new mentee, and I'm very now a new grandma, and loving it. So sponsoring is a very important part of our jobs. I'm the Vice Chief of Academic Affairs and Research at Rush. And so one of my jobs is to promote my colleagues and to make sure that we do research and academic activities. So it's just an amazing and fulfilling job that I now have in addition to seeing patients. I've learned how to promote people, and I've learned how to get people to do research. And so I'm doing that now. It's been an incredible career. It's been an incredible life. And I am just so grateful to Hunter for what they taught me, because it was the foundation that led me to the things that I was able to do as a cardiologist, as a professor of medicine, and as a citizen of the United States. So I'm very grateful for what they've done, because without them, I would not have been able to do all these things. And one of the best things that has happened to me is that I was given an endowed chair, which means that a donor at Rush gave $2 million, and now I can use some of that money to help my faculty, my fellows, and it also offsets my salary so I can do the things that I want to do. So I'm very fortunate that I have achieved what I have achieved, and I thank Dr. Wenger, Dr. Rosen, Hunter College for where I am now, because it's been an amazing life. And then I'm going to end, please go to the next slide, with my support system, which is my whole family, my husband, my children, who now have their special someones, and the two dogs that we have. And then my two best friends. Elena Camel is an OB-GYN. So you can imagine we found something that we could do together. When we started talking about heart disease in women, she goes, hey, I can help you with that. And so we've become the best of friends. She went to Barnard, and then my friend, who is Liz Sharp, who's a lawyer and the mother of the children of my children's best friends. So it's just an amazing life. Please go to the next slide. And then I wanted to show you, these are my two friends from Hunter College High School. And we just went to Jordan, which is a dream of mine, to see Petra. And we were fortunate enough to have gone last year before October 7th. And so, even though it was not, as safe as it could be, but we were able to go to Jordan. And these are my two best friends from Hunter College High School. So I have not forgotten Hunter. It's always in my mind. And so I thank you for letting me be what I am. Thank you.
Hello to everyone, and this is the beginning of the Heart of Hunter Part 2. About a year ago, we decided it was really important to teach both men and women about the major medical problem of women, and that is heart disease. And I prepared a presentation a year ago. And what has happened is that over the year, both some of the members of the Alum Association and I have gotten requests saying, we really want a reprise of this. And of course, nothing is as great for a teacher as to be asked to do an encore. So this first part is an encore of what we did a year ago, and then I'll have some additional information to add. Let's see what we know about heart disease in women, because you take a professor and give them an audience and a podium, and here you have a lecture. And I think the important thing to realize is that heart disease causes more deaths for women in this country, and actually most of the world, than that from cancer, lung disease, Alzheimer, or accidents combined. And we were doing well for a number of years. But surprisingly, what has happened is that the young women are the ones who are doing poorly. And I expect that it's simply because we've not messaged prevention, 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 because what we're seeing is that among the young women, 35 to 44, 54 years of age, coronary deaths are increasing. And that reverses the benefits that we've seen for 40 years. Some of it may be the obesity epidemic, some of it may be sedentary lifestyle. And one of my colleagues called this the leading edge of a brewing storm, because now we have a younger population of women who will be living their lives with the clinical manifestation of heart disease. And what we see is that the problem is worse for Black women than for white women. And what this does is it parallels the fact that women of racial and ethnic minorities are less aware of their heart disease risk than are white women. And the awareness is what I want this program to improve. Next. So this is an owner's manual. We have a manual for our cars. We have a manual for our washing machines. We have a manual for our dishwashers. So what I'm going to do this afternoon is to give you a manual for your heart. And what does the owner's manual have? It has technical specifications, the parts and the features. A heart is a muscle pump. It's a little bit larger than a clenched fist. It weighs less than a pound. It beats over 100,000 times every day, pumps about 2,000 gallons of blood every day. And that's nearly 5 quarts of blood every minute. There are about 60,000 miles of arteries and capillaries and veins. Now, if you take care of this heart, what is the warranty that the owner's manual gives you? That's the white woman will have a warranty of an average of 81 years of life. Black women a little bit less, but you have to read and study the owner's manual very carefully to learn something about the operating instructions. And what are the concepts for an owner? What is involved with the care and maintenance? Awareness and education. And one important message: favorable lifestyle changes can lessen cardiovascular risk factors and can prevent cardiovascular disease and coronary disease. And it's not the same. It's not a one-size-fits-all. You have to know what is your risk, and therefore what is the intensity of the intervention. The message, though, is that behavioral changes by us, by women, and reshaping of practice patterns by our healthcare providers can decrease the number of women who are disabled and killed by coronary disease every year. But this is a partnership. It's a partnership between women and their healthcare providers. But to be a partner, you have to be informed. Now, what about the operating and maintenance instructions? I'm going to talk today only about lifestyle interventions, but there are specific risk factor interventions and drugs. We'll save that for another day. Next. Let me give you a few examples of the research data that underlie the owner's manual. If you quit smoking before age 50, you have half the risk of dying over the next 15 years than if you continue to smoke cigarettes. Smoking cessation improves lung function by 20 to 30% within 2 to 3 months, immediate benefit. And after a year of stopping smoking, the risk of coronary heart disease is cut by about half. And within 5 to 15 years of stopping smoking, the risk of stroke is the same as if you've never smoked. So toss away that package of cigarettes. Next. Walking cuts women's heart disease risk. We did a study a number of years ago on some 72,000 nurses and found that vigorous exercise and even brisk walking reduced the risk of heart attack or coronary death by 30 or 40%. And even those women who were sedentary, but later on began moderate walking, reduced their heart attack risk by 20 to 30%. And even walking at a slower pace is beneficial. It's a multiplying effect. You walk at a slower rate, you do it for a little bit longer. Now, this is Wenger's 250-250 rule. And I think lots of people like it. And what you do is you exercise an extra 250 calories a day. You eat 250 fewer calories a day. That equals 500 fewer calories per day. We could all multiply. That's 3,500 fewer calories a week. And that's a pound of weight loss. That's the simplest way to look at it. Next. Let's talk about one issue, and that's diabetes. And years ago, there was this diabetes prevention program. And this was overweight, not really obese, just overweight women, and physical activity for 30 minutes a day and losing just 5 to 7% of body weight, very small amount, reduced the risk of getting diabetes by over 50%. If you can exercise and lose a little bit of weight, you're less likely to become a diabetic. And then we have what are called things that are not useful or maybe harmful. For years, women were told, just take hormone therapy after menopause and you'll be protected for everything. When we started doing the trials, we found that there was no cardiac protection. So hormones should not be used for cardiac protection. And then all of these wonderful vitamin supplements, vitamin C, vitamin E, beta carotene, and all my patients loved their vitamin supplements. They didn't do good. A few of them did far, but it didn't prevent heart disease. Now, this is a long list, and I think you can get this from the slides. I'm not going to spend much time on it, but I think women should have a list of the features that might increase their heart disease risk and bring that list to their physician and say, do I have any of these? If I do, is there anything I should do? Because this whole long list are relatively specific for increasing women's risk. What I've done is to give you the manual. And remember that the warranty on your heart is only as good as you're following the directions in the manual. Now, this is a little bit different. And this is what everyone should know about a heart attack. Because what we've seen is that a number of years ago, there was a great deal of messaging to the community of the symptoms of heart attack, how to recognize it, and how to respond. And people did fairly well. More people, specifically more women, were aware. And when we did in 2019, now this is pre-pandemic, 2019, a survey, we found that most of that teaching was gone. So we have to start from square one again. So what I'm doing is starting from square one again. The problems are the risk factors. Certainly, when we look at heart and stroke, we worry a great deal about diabetes and we worry about cholesterol. Almost 10 million people have undiagnosed diabetes. They have it and they don't know it. There are almost 30 million people who have a diagnosis of diabetes, and there are over 115 million who are just on the verge of diabetes, at the point where physical activity and eating properly can keep them from developing diabetes. And then the cholesterol. A fourth of people in this country have a high cholesterol. And what we see is that maybe more than 3.5 million deaths are due to high bad cholesterol. LDL is the bad cholesterol. And as one of my residents said, L stands for lousy. So remember, LDL cholesterol, lousy cholesterol. Now, what happens with a heart attack? If you understand a heart attack, you'll understand why a prompt response is so important. Here's a picture of the heart. There's a picture there of the coronary arteries that circle the heart and provide blood supply to keep the heart alive. And in this little segment of the illustration, you see the plaque, the atherosclerotic part in the arteries. That's the lipid, the fat, the cholesterol that accumulates and narrows the arteries. That's what we're trying to prevent by reducing risk factors. And then what happens is that a clot forms and totally obstructs the blood flow. And the heart needs oxygen from the blood in order to survive. And the symptoms that happen when that clot occurs are the ones that we're going to be talking about. Now I can have the next slide. And what are the common heart attack warning signs? Discomfort, pain, pressure in the chest, lightheadedness, dizziness. Certainly it can be in the neck, back, arms, etc. Certainly what we can have is pain in the shoulders, etc. And sudden onset of shortness of breath. Doesn't mean that you're just chronically short of breath, but something sudden that happens. And what I tell my colleagues in the emergency department, and what I tell my prospective patients, is that particularly for women, any acute symptom between the jawbone and the belly button can be a heart attack. Something that comes on suddenly makes you feel bad. What should you do next? There's a difference with men and women. And I don't know whether it's a real difference. I think it's a real difference in symptoms, but I think it's also a difference in communication. Men are noun verb people. Women are adjective adverb people. So the man will say, I have chest pain. I'm having a heart attack. But they may have nausea and vomiting. They may have jaw pain. They may have squeezing pain. They may have shortness of breath. But look at that list of symptoms in women: nausea, vomiting, jaw pain, chest pain, pain or pressure in the chest, shortness of breath, fainting, indigestion, etc. The women will describe everything that's happening, and sometimes the acute symptoms can be lost in the recitation. But I think the women who have acute symptoms should say, could this be something bad going on in my chest? Next. And what do? A heart attack happens every 40 seconds. And I've shown you what happens with the anatomy when that blood supply is cut off. And only about half of the people who were queried knew that lightheadedness, jaw, neck, back pain, arm, shoulder pain, shortness of breath, in addition to chest pain, could be the symptoms of a heart attack. So you have to know the symptoms, call 911 immediately. Don't worry that this may be a false alarm. Act fast, because delays can mean your life. Next. So how do you lower your heart attack risk? If you have any kind of heart disease or if you have risk factors, take your medication. Again, follow with your healthcare provider. If you have disease, participate in cardiac rehab. Certainly learn and manage your risk factors and get support. There are friends, there are family members, there are community that will help you do this together. And the message is, it takes a village. It takes everyone to participate in preventing heart attack. And I thank you for your attention.
Well, thank you first. Let's start with the disclaimer that I am not a Hunter College High School graduate. My mother is a Hunter College 1960 graduate, though, and she's thrilled that I'm here. And I'm thrilled that I'm here, more importantly. So after speaking with Dr. Volgman and Dr. Wenger, we thought that I would finish up, take us home, talking about brain health, stroke. The American Heart Association is actually the American Heart Association and American Stroke Association. And what's fascinating about what we've learned about brain health over the last 20 years is that so much of what Dr. Wenger just spoke about, the essential 8, the connections and how to stay healthy, the importance of advocating for your health, can actually keep our brains healthy. And when we talk about brain health now, we're not just speaking about preventing stroke or transient ischemic attacks, mini strokes, but we're also talking about improved cognition, and it all comes together. Next slide, please. So let's start with some definitions first. A stroke or a cerebrovascular accident, CVA, is a disease that affects the arteries leading to and within the brain. So similar to that slide where Dr. Wenger showed that an artery, which feeds the muscle of the heart and brings oxygen, can be blocked. The artery, a tube, like in our plumbing, can have plaque, fat, cholesterol in it. Well, our brains are fed the same way. Large arteries in our neck, as well as yards and miles of arteries and veins in our brain. And a stroke, or CVA, occurs when a blood vessel that's carrying the necessary nutrients is either blocked by a clot that breaks off, it can burst or rupture. And when this happens, part of the brain behind that obstruction, sort of like a tributary getting blocked by leaves, when it can't get oxygen and nutrients to it, the brain cells die. Next slide. There are different types of strokes. This is a primer. Again, I guess we'll call it our owner's manual, Dr. Wenger. An ischemic stroke is a stroke that's caused by a clot obstructing flow. So we used to also joke about calling a CVA or a stroke a brain attack. The same reason, that the same explanation, the same etiology, the same explanation for a stroke. A hemorrhagic stroke is a stroke that's caused by a blood vessel rupturing, and the blood actually starts to fill in the space. Our brain is held in by a non-distensible skull, and so if you bleed into that area, hemorrhage, that can cause brain infarction as well. A transient ischemic attack, sometimes called a mini stroke or a warning stroke, can be caused by spasm or clot, but the symptoms, and we'll get to that in a moment, resolve. A transient ischemic attack is not a one and done. It is often an extremely important and never to be ignored warning signs, because transient ischemic attack is quite likely to be followed by a complete stroke. So you can almost think of that as a stroke in evolution, and again, something that requires immediate attention. Next slide, please. So let's talk about the warning signs, because similar to the slide that Dr. Wenger showed you, These are things that we should all know about because the importance of addressing them immediately is critical. So for some, a sudden numbness or weakness of the face, arm, or leg, especially if the arm and leg are on the same side of the body. For some people, it can be a sudden confusion or a loss of the ability to speak fluently or a loss of cognition, and it can be quite acute. Sometimes it can be a visual abnormality, maybe seeing double or seeing a split screen in your visual fields. Some people get dizzy or loss of balance, coordination, and difficulty walking. And others can complain of a very severe headache with no known cause. The worst headache of your life is an emergency and should never be debated. Is it this? Did I not get enough sleep? Is it my allergies? And these are the things that we look for. So as FAST has become one of the ways that we remember what to do through the American Heart Association, American Stroke Association. Face drooping. If you ever look at a friend or colleague or look at yourself in the mirror and feel as if there's an important and likely new asymmetry, that is an emergency. Ask somebody to smile if you ever are suspicious that something doesn't quite look right. Arm weakness is the A in FAST. Is one arm weaker? Patients have told me that they've dropped a spoon or they'll be writing and just feel, maybe it's tingling, maybe it's nothing, and you'll shake your hand and try to see if it'll go away. As the speech, is the speech slurred? Is an individual unable to speak fluently? Ask them to repeat a simple sentence. And again, oh, no, it's fine. I just didn't sleep well. Again, these are not the things to put where that denial comes in. These are things that are emergent. And then finally, T is the time to call 911. These are the times that you do not drive yourself to a hospital. You do not negotiate, oh, dinner's in the oven, my kids have homework to do, because time is brain. Similar to, we used to always say time is heart muscle, time is brain. And so many of the spectacular new ways that we can treat and abort the signs of a stroke require you to get there fast. Next slide. Stroke is the number 5 cause of death. In Black women, it's even higher. It is an extremely high cause of disability in the United States. And because the reasons one can have a stroke are so different and myriad, it can happen to anyone. There's a spectacular shared story on the American Heart Association website. It's heart.org by a neurologist in her 40s who had a stroke. And imagine knowing what you're going through at an age that you really felt to be too young. On average, almost 2 million brain cells die every minute. And we have a lot of them, but they don't regenerate like skin cells. Early treatment is critical for survival and lower disability rates. Calling 911 and explicitly saying, I have weakness on the left side of my body, my speech is funny, my smile is off, allows the 911 operators to send the right type of ambulance and to send you to the right type of hospital, because not in large cities, crowds, traffic in Manhattan, not every health system, every hospital is the optimal place to be. Next slide. Women face a higher risk of stroke. 1 in 5 women in the US will have a stroke. More women have strokes than men every year. It is the number 3 cause of death, number 5 in men. And among Black women, Black women have the highest prevalence of stroke, probably linked to the higher prevalence of hypertension and not ideally treated hypertension. Next slide. Talk to your healthcare professional about how or lower risk. Similar to what Dr. Wenger said, these are the questions to ask your doctor. Stroke risk increases in women who are pregnant. And what happens during pregnancy, we joke, what happens in the obstetrician's office should not stay there. Even an 80-year-old woman who comes to our offices, we ask about pregnancy related. I laugh when 60-year-old women look at me as, oh, I don't even remember that, Stacey. You have to, it's critical. Preeclampsia, which is a very severe form of high blood pressure during pregnancy, raises the risk. For certain women, bring on oral contraceptives. And for the young women, we should be careful about prescribing birth control pills and take a good history of young women to be sure that their risk is understood. Again, those with hormone replacement, as Dr. Wenger and Dr. Volgman spoke about. We've recently discovered that women who have migraines with aura, that sort of sparkly feeling in your vision that you'll have, for some reason are higher risk for stroke than women who have migraines without, or those who don't have migraines. And then a favorite of my friend Dr. Volgman is atrial fibrillation, a very common form of rhythm disturbances that has been unfortunately undertreated, as Annabelle told us, in women. Next slide. The good news is, again, similar to heart attacks and heart failure, most strokes can be prevented. Talk to your clinician about the safest medications to use to manage blood pressure. I love when a patient says to me, "Oh, it's just in your office, Dr. Rose, and I don't really have high blood pressure." Well, I'll come back in 2 months, and I'll let you go on a I'll let you place me on a medication. It's not the presence or absence of a medicine that determines high blood pressure. So if you have it, let us treat you. We'll find you an easy way to lower blood pressure with minimal cost. It's not a badge of courage to try to think that you can, outrun your genes. Get your blood pressure checked regularly. Some of the home monitoring equipment is actually much less expensive than it used to be and quite accurate. I recommend if you buy a machine, that you bring it to your clinician's office just to check that it's functioning properly and that you're using it correctly. Quit smoking. We're back to the same things. And for those over age 75, excuse me, atrial fibrillation, we've even seen TV commercials now about some of the blood thinners, becomes more common. And to Dr. Volgman's point, those palpitations that is often minimized in women as stress or, go out, enjoy yourself, can be atrial fibrillation, particularly over 60. Next slide. So together to end stroke, the American Stroke Association focuses predominantly on blood pressure. It is, after tobacco use, the most prevalent and manageable risk factor for stroke that we have. Let us treat you. Normal blood pressure is below 120/80. Several years back, the American Heart Association, American College of Cardiology came out with new recommendations, and the joke in our offices were overnight, 50% more Americans were diagnosed as hypertensive. That's not because we want to treat more people or we want to give medications. It's because our science has shown that, in this case, lower is better. So the old days of thinking 140/90 or blood pressure for seniors of 160 is even okay. We know better now. We know that 80% of strokes can be preventable. And at age 50, ideal cardiovascular health, which is doing the essential 8 that Dr. Wenger spoke about, it's a reward. It adds duration, and more importantly, it adds healthy years of life. Next slide. Terrific. We spoke about stroke. We spoke about, again, the importance. Have your blood pressure checked and learn about self-monitoring, because much of our data shows that the pressure that we get in a clinician's office is probably not as valid and not as important to manage to as the pressure that you have in your regular day in life. Next slide, please. This is how you take blood pressure, and I'm so proud of the American Heart Association that when they made this cartoon, they made one for a man and one for a woman. We're so tired of the days that all of the cartoons look like men. And she's in a red dress, like Dr. Volgman's closet. There are correct ways to take your blood pressure. You don't slap the cuff on when you're running on a treadmill or after your 4th cup of coffee in the morning. And this matters, because if we're going to treat to this and identify levels, categories of high blood pressure or normal blood pressure, you want to do it right. And this is also available for free on the American Heart website. Next slide. Lifestyle changes. It's pretty much exactly what Dr. Wenger went through. It almost feels silly and redundant, but every one of these are the slides that Dr. Wenger went through. Secondhand smoke I'll bring up, regular exercise, limit alcohol. I don't think Dr. Wenger mentioned that. Don't drink, isn't red wine good for me? We don't add alcohol to prevent heart disease. Okay? And there's quite a debate amongst the cardiologists, the cancer doctors, about the toxicity of any alcohol whatsoever. Take your medications as directed. And Dr. Wenger said, sitting in the bottle, put an emergency couple of pills in your pocketbook if you're going to forget. don't allow your prescriptions to run out. And if you have side effects from something, call your pharmacist, call your clinician. Reduce stress has quite a lot to do with it. And stress, we all live with it. But the American Heart Association has written some pretty important scientific papers on things like mindfulness, meditation, yoga. Next slide. And here we are. These are the 8. And our colleague from Chicago, who was one of the premier writers on the paper that was originally went from 7 to 8 just a few years ago. And Dr. Donald Lloyd-Jones wears an 8. You'll see that we 3 are wearing red dresses, but Don wears an 8 on his, because these are essential. Next slide. I think that's it. So thank you again for inviting me.
I'm going to open up for some questions if anyone has any questions. Elle?
I did actually have 2 questions.
Okay.
And this is just partly from personal experience and partly because of a relative of mine. I wanted to know I think Dr. Rosen just spoke about the ischemic stroke or transient ischemic attack. I'm sorry if I'm not pronouncing it properly, but I wanted to know if there was any possibility that can sometimes be misdiagnosed for a seizure.
You did pretty great on that. Transient ischemic attack, you got it.
Ischemic. Okay.
Ischemic, yeah. When insufficient blood causes insufficient nutrition of cells, they become ischemic and they don't get appropriate blood supply. Yeah, it's quite interesting that sometimes the diagnosis of stroke and specifically some kind of seizure disorders can overlap and make appropriate diagnostic, particularly quickly, a challenge. It is less likely that a stroke will present as a seizure, honestly, but in the workup, there is an overlap between the 2 disorders.
Can I just add also, in some people, because there's lack of blood flow to part of the brain, they can start seizing. But in somebody who's never had seizures before, I would assume that they are having a stroke before assuming they're having a seizure. So they need to be treated very quickly. You need to call 911 and say somebody's having a stroke. They need to be brought to a stroke center. In major cities, there are stroke centers so that they can be immediately treated, evaluated, and they can pull out the clot to prevent damage to the brain. So that's one of the initiatives of the American Heart Association, was to encourage cities to have stroke centers. And I'm sure you have it in New York, we have it in Chicago. There are designated hospitals that you can take people to who are having strokes, because you can prevent a stroke. Stroke, you can have, just like heart attacks, it takes about 4 hours to completely damage the brain cells and the heart cells. So the sooner they get to the hospital, the less damage it will cause to have a stroke. My mother had a stroke, and even the small damage that she had just ruined her life, because her gait was no longer normal, and she just kept falling, and so it decreased her mobility and it just ruined her life. So I can't emphasize enough how important hypertension treatment is, because and we have a rule at our hospital and most hospitals that if somebody presents with a blood pressure of 200, they cannot go home. They have to go to the emergency room, because they could have a stroke with a blood pressure of 200 or above.
And actually, probably the newest advance is that in many major cities, there are specially trained mobile stroke units, so that the 911 response goes out to a stroke unit, and treatment and diagnosis is started en route to the hospital, so that just as we say for the heart, minutes is muscle, it's also minutes is brain. And we have been very fortunate in Atlanta that the hospital where I'm based, which is a public hospital, has a mobile stroke unit so that the patients can be imaged and the treatment can be begun en route to the hospital and continued once they arrive in the hospital.
Because I'm the only one of my hunter friends who is practicing in New York. So yes, there are several throughout. I mean, again, we're privileged to be in a mecca for healthcare. But the importance to both points is that when you call 911, you let them know what you're nervous about.
Okay. No,
You
that's
see, one of the things that we've talked about is the tremendous disparity between rural areas and urban areas. And being in a rural area currently is bad for your health in terms of acute illness, simply because so many of these major advances just cannot occur in rural areas. We're beginning to make some advances because what we're trying to tell the receiving hospital in the rural areas is that a patient with a heart attack, a patient with a stroke needs to be airlifted to an emergency center. And typically now there are triage plans in place that I think will improve rural health.
That's fantastic. Thank you for that. I did have one more question. I'm sorry. Take up the time. So, Dr. Wenger mentioned a very young age demo, I think 35 to 54. And I have a personal friend who had Bell's palsy around 35. Maybe some of the risk factors you talked about could have been a contributing factor, but had Bell's palsy, it went away. But what would be her, I guess, percentage factor for maybe a heart attack or stroke in the future? Like, even if it goes away, does it decrease? Is that a good sign or?
It's true, and unrelated. Bell's palsy is not a risk factor for stroke. It's a specific nerve damage. But I think the important thing is for young people to be aware that their heart is vulnerable. Most young people think, I don't have to be in worrying until I'm age 50 or age 60. And because of that, they disregard their heart health, they disregard their risk factors. And I think we've begun to train all the healthcare professionals to realize that sadly, we're seeing both men and women in their 30s, 40s, and 50s with serious heart attacks and strokes in our intensive care units and in our laboratories. And 80 to 90% of this is preventable.
You know, what's kind of neat to what Annabelle said and Nanette, our relationship with obstetricians, because for so many young women, their OBGYN is their singular doctor. So much partnership between cardiology and OBGYN to focus not just on the bikini parts, but on early opportunities to prevent heart disease and stroke. And it's been a lot of fun for us to work with gynecologists.
Well, the American College of OBGYN has really addressed this because, you know, our OB colleagues are in the preventive mode. They order mammograms, they order pap smears, etc. But for a long time, they were not addressing the major health risk of the women under their care, and that is heart disease and stroke. And now this is rather routine in most of the good OB practices. First, the U.S. Preventive Services Task Force requires that a blood pressure be measured at every OB visit. And if that isn't being done, that is not good care. And then there is specific identification of the women whose blood pressure is too high. Now there are even lower targets for the treatment of high blood pressure during pregnancy. The OBGYNs are very aware of that. But the important measure is this, that the woman who has hypertensive complications of pregnancy, particularly preeclampsia, that when she is seen at her follow-up visit, she has to be told that that puts her at increased risk for heart disease later on in life, and that she really has to watch, get rid of the baby weight. Don't start smoking again if you smoke. be physically active, get your cholesterol checked, get your blood pressure checked, certainly all of the risk factors, plus the fact that the children, both the boys and the girls, of the woman who's had preeclampsia are at increased risk for developing risk factors early on in life. And this is something that the pediatrician should be told. So now we have involved in our cardiology community, not only the OBGYNs, but the pediatricians.
Good. I personally, my primary care provider, they are all Emory doctors. So, and partly due to Dr. Wenger.
Obviously, very good healthcare.
So, I mean, at the last Heart of Hunter, it was very inspiring.
Like they just wanted you to remember us. Nobody exchanged with them.
Yeah, my primaries are there, but due to your last presentation, for Heart of Hunter Part 1 is really what encouraged me to start really getting deeper with Emory and to kind of start, you know, I guess analyzing as a young person, my own risk factors. I have epilepsy, and I was going to ask if that maybe was something that if there's other things that I maybe should be thinking about doing to help my own risk factors for the future. And that is my last question, I promise this time. I'm so excited about this. This is so fantastic. I wish more young people would get on this because this is so.
Spread the word. Please help us spread the word.
Yeah, this is so cool. I'm sorry.
Go ahead. Do you want to repeat your question? Do you have another question? Or was that
Yes, I was asking for someone like myself who suffers with epilepsy. Is there anything that I can maybe do outside of the Life's Essential 8 differently, or that I maybe should consider closer for the future to help mitigate any of my risk factors?
Not particularly.
No.
I think you should just follow the same thing that we had been discussing. Epilepsy doesn't usually, as far as we know, at this point, there is no associated risk.
No relationship.
Yeah, exactly.
Thank you.
So,
Thank you.
any more questions, Jim?
Diabetes could cause. Is that true?
They can sometimes present differently. They don't say the same, just like what Dr. Wenger said, I think it's a communication issue. But there may also be some possibility that nerves of diabetics are not the same as people without diabetes, so they may feel something different. But it doesn't usually.
Well, you know, years ago, people said that diabetic patients didn't have the usual symptoms of heart attack. But you know, years ago, what people thought about was what I and others have termed the Hollywood heart attack, with someone getting severe chest pain, clutching their chest and collapsing. That almost never happens. And most people don't have the typical Hollywood heart attack. And the symptoms that the diabetic patients may have will be heaviness, pressure, discomfort, shortness of breath, etc. So I think we have to get away from the Hollywood heart attack and look at that whole list of symptoms that we present.
I just wanted to invite Miss Lisa Siegman into our conversation today. She is the campus director of Hunter College Campus Schools, and I know she had some remarks for us today, and I definitely wanted to hear a little bit from you as well. Lisa?
Oh, thank you, Elle, and extraordinarily grateful to three wonderful women. I'm so glad I had the opportunity to see you when you were on campus speaking earlier this year, and to then hear your follow-up again is just, it's both inspiring, but also really grateful. And I too, Elle, have been like, yeah, Lisa, get your act together on this health piece. So thank you for all that you do. As we wrap this wonderful event up, I give great thanks to the Alumni Association for bringing both your legacy and your connections into our hearts. But I also want to take a special moment because while the students of Hunter College, the graduating seniors, soon to be almost alumni who are right now on spring break because it starts right now, will have the pleasure of being able to honor our own Dr. Nanette Wenger, who has just been selected as the distinguished graduate for the year of 2024. And I know that she is aware of this honor. We look forward to being able to celebrate her accomplishments and to welcome her in person back on campus, we hope, for graduation. And this is just such a privilege, and we are so proud of you and your accomplishments. And we're so grateful to all of you for always remembering that Hunter was just a tiny part of your tremendous accomplishments and your career. So I am grateful. I'm grateful to all of you here, both watching this great day, but also who participated. And I wish everyone the very best. So thank you. And I look forward to seeing you all again very soon.
Thank
you.
you. All good? Okay.
I didn't know if anybody had any more questions.
From the symptoms listed earlier, a lot of them can also be common in like menstrual pains and stuff.
Yes.
How can we differentiate those?
I often tell women, particularly young women, that you want to really know your body, and you really want to have a clinician who becomes your partner, not just I'll stop in at an urgy center, or it's an ad hoc sort of relationship. Because then, when you develop these sorts of symptoms, you have someone who you trust that knows you. If it's every month on day 4 of your cycle, then it's less likely, right? That's what you're doing every month. But if all of a sudden something feels I'm in the middle and I don't usually get breathlessness, or I can climb more steps, you want to report that back to your clinician. And as I think Dr. Wenger said, call 911, address that concern. We'd rather laugh about it afterwards than miss something that could be, a really urgent issue.
Thank you. Good question.
Yeah.
It's a brilliant question for young ladies whose bodies are changing. So, at the beginning of having a menstrual period, it comes when it comes, and doesn't fit any of the prescribed cookie cutter ways that a lot of the books tell us that everybody experiences a menstrual period. But I think the understanding your normal is such an important component of it. I have children with genetic disorders. They have Ehlers-Danlos syndrome and POTS, and they know they're normal. And we have worked very hard to aggregate a group of general medicine and specialists who know them well enough to be able to trust when the girls report what they report, that they're reporting something to actually talk about, as opposed to some other dismissive thing that happens to young people and to women all the time.
This is why it is so important that everyone have a primary care, someone with whom the questions can be discussed, and someone with whom general health issues can be addressed early on before they're problems. We're really talking first about wellness, and only then about disease prevention. Wellness is something that's very positive and that primary care physicians are uniquely trained to address. So it is important that everyone in your family have a primary care physician. It need not be the same person. Different people will have different needs, but everyone should have a ringmaster for their health, and that's your primary care physician.
Hello, I'm Jane Tillman Irving, Hunter College High School, 1965. I have my senior button in my bag and I'm wearing my ring. And I just wanted to thank everybody out there for participating in this very important, very, very important second part of Hunter presentation, because we've learned so much from Hunter girls and Dr. Rosen. We'll make you an honorary for the day. That so much can go wrong but there's so much that can go right because of what we've learned today. And as we sang about gym class in my senior sing, if you think you might be failing, well, no, not failing, but if you think you might be sick, don't be scared, be prepared. So that in that case, what we want people to do is take all of this information home, be aware of it, be aware of all the things that can go wrong and how much we can do to prevent them and how much we can do to save ourselves. We are hunter people, brothers and sisters. We're smart. We know what to do. Let's do it. Thank you all so much, doctors. We appreciate you. And thank you to our staff and the Alumni Association for putting this together. And thank you, of course, to Lisa, who is always a great supporter. Thank you.
Thank you.